We have gone through inhalers, spacers. If you need to get more information about that, please go and take a look at some of the videos. I'm not trying to be repetitive. This is a longer version for the most serious patients that want to get to the bottom of their illnesses and practice proper inhaler techniques, understand a little bit about their medication. And I want you guys to be comfortable with your medications. I want you to know what they are so you're not mixing them up, okay? When you have a quick relief or rescue inhaler or rescue pump, those are meant for as needed. And they're usually written that you're going to be taking them as needed for certain symptoms. Those are things like shortness of breath, wheezing, chest tightness, if you don't have cardiac disease, of course, coughing, if you're a cough variant. If you're exercise induced, you probably will be taking that right before exercise, about 20 to 30 minutes before exercise. You will take your inhaler properly before exercise so you can optimize your lung function while you exercise, okay? You don't get wheezy, tight, and all those symptoms that we are diagnosing you with for exercise induced. Whole different topic. I'm going to make a separate video about that. But you will obey that law of, hey, before exercise, you know that you're going to the gym. You know that you're going to go take that walk, which is, by the way, a fantastic way to keep yourself healthy. I'm a strong believer of exercise. It's been a year. I'm working out religiously every day, and I can see the energy that you get. And I also notice that most of my patients that are exercising on a daily basis, they are the best in their class of illness. If they are severe and we treat them, we manage them, and they get better and they are active, they do better than the severe who is completely bedbound, limited, and we've optimized them and we can see that they are controlled, but they accept the world saying, well, I can't do it right now, and there's a lot of I can't, and everybody has cleared them medically to go exercise, but they are not exercising or they're not pushing themselves, because you do have to push yourself to exercise. Once you get over that hump and you know that exercise makes you feel good, you feel energetic, you feel happy, it's kind of like I think it's an antidepressant, to be honest, because it makes me very excited all the time. So much energy. You feel like a burst of energy, especially if you do it in the morning. Okay, I'm a strong believer of morning. Early morning, you get up and you go and you move. And that energy is so good for your lungs. Anyways, if you're one of those patients, exercise-induced, I went in a tangent, you want to do your inhaler 30 minutes, 20 minutes before. That is your rescue we're discussing. The one that says albuterol sulfate, Ventolin, there's many. I'll list them up there. But anyways, when we go back to these inhalers, we are now talking about the inhaled steroid. You're asthmatic? That's a key inhaler. You want to know it by heart. You don't want to be looking at a list when you're talking to me. You want to tell me, yes, I have asthma, and I take, let's say, Advir, or I take Symbicort, or I take, there's many different. If you're from a different part of the world, these will be different names, okay? But we're looking for the steroid component. That inhaled steroid is what is keeping your asthma calm if you've been prescribed that. That means somebody thinks your asthma is severe enough that you need an inhaled steroid. And if you are mild, maybe you may not get that, but definitely if you're moderate, persistent, or your doctor says you're severe, persistent, very severe, persistent, those people really need to have an inhaled steroid. In fact, I don't think I have a patient in my clinic that is in that level that doesn't take the inhaled steroid, because if they don't, we're going to have issues. And you can't really schedule it anyhow you like. These inhalers that have inhaled steroid in them, they build on themselves. So the point is that if it's your staple inhaler, that's the one that's keeping you away from visiting us very often, visiting the ER very often, right? Or having multiple exacerbations, or when everybody gets a cold, you're very sick. If they're preventing you for all that, and then you keep it and you're using it as needed, and then you're using your albuterol as your schedule because you think the quick relief is better, you've already gotten all screwed up and you're all messed up. And everything is all messed up, and your doctor may not even have the time to figure it out. But you're doing that on your own, right? You're doing your own cooking. You're throwing in your own spices into your medical history, and you're being your own doctor. your doctor wrote something, they assume you're following it. And the thing is, we really need to check and ask you, put you in the spot. That's how we best assess you. Hey, tell me what you're on, what you take. The minute somebody's looking at a piece of paper to find out what they're taking, I'm already not trusting them. I lost trust already. You should know the name. You should know how the canister looks like. You should be bringing it with you to every pulmonary appointment. And this way, I can discuss it in detail, check you, right? Rather than describing. Or maybe I may send you to a video to take a look now that I have a library of videos of which devices and how to take it. But it's better when you bring it. You're coming to see us. You're using your money to come see us. Make the best out of it. Show us your inhaler. Practice in front of us. Show us that we're doing the inhaler properly. And if you're not, we can correct you, okay? As if we know. Because some clinicians don't know how to do that. And they should really review it or should tell you, honestly, if they don't know, look it up on YouTube rather than try to mess you up and mix you up and you don't know how to do it. Not all doctors know it. Believe it or not all pulmonologists know how to use these inhalers either. They just prescribe them. And they think the pharmacist is going to give you the directions. Anyways, not to ramble on for too long, I just want you to know that inhaled steroid is the critical point. This is the reason we're having this little longer video for the asthmatic. You find your inhaled steroid, whether it says budesonide or the rest that I'm going to list on your video today. You want to take a look at that and say, well, this is the one. Okay, like Symbicort, yes? And I have to give my Symbicort reps a shout out because they are very good at providing me. Most of these demos come from them, AstraZeneca. I've kept them for years. They're 10 years old, some of these devices, etc. So shout out to all of them. I can't name them. I don't want to, anyways, doesn't matter. Anyway, so we're going to go back. So we have these inhalers and we decided, okay, we are on Symbicort or we are on Advir or we are on Flovent. And some of them mixed with albuterol or not. You're on those inhalers. Now we want to determine how you're using them. We say once a day, rarely if they look like this. Usually it's twice a day. Okay, please don't make them once a day. If we said twice a day, you stick to twice a day. Okay, and you keep the schedule so that it's about 10 to 12 hours apart if it's twice a day. Usually these kind of devices, when they have the inhaled steroid inside, they're twice a day. Cross-check that with your own pulmonologist, your pharmacy, your healthcare provider. And if they don't know, they need to look it up so they don't mess you up again, okay? Sometimes they even give you samples and they don't even know how to give you the directions properly. They should look it up. Or they should tell you, here are the samples, we don't know how to use them and let me look it up. Okay, it's okay, we can't know everything. Anyways, now you have your prescription and you're on an inhaled steroid. We've determined that you're on it and we've prescribed it and we've told you that this is the main part. So what we're thinking is that you're going to be using this, and we're assuming and we trust that you're going to follow this medication as your staple medication. You're using it twice a day. Okay? If it's, let's say, Brio, it's once a day, right? And that's different because your prescription is going to say once a day. It will not have as needed. So please don't make Brio or an inhaler that's once a day, which I think Brio in our annuity is once a day. Those inhalers are once a day. You use them once a day. But the ones that are scheduled for twice a day, and then you drop it to once a day, that's a problem. It's not going to work very well. You take the first dose, it gives you some, let's say it gives you, for example, 10%. The next one is 20, the next one is 30, the next one 40, 50, 60, 70, 100, and then it holds it at 100 with you keeping it up into that schedule. If you decide to use it as needed, then it goes 10, then we go to 20, let's say, then it goes back to 0, then you go 10, it doesn't work. Then you start using albuterol a lot, then you're on the nebulizer all the time. It's not working. And then the thing is, you think it's your doctor. It's not your doctor, it's you. You just change your own thing. And you need to cross-check with your doctors. Go back to your pharmacy and find out, oh, how did they write them again? Cross-check. Make sure you know how to use it, okay? So this was just a whole discussion about how patients are prescribed one thing and then they flip it to another thing, or they don't want to take any medication. So I'm just going to do my own thing. And then they come and see you. You just wasted a visit. I would check.